Etu is a senior lecturer at the Department of Psychological Medicine at the University of Auckland and a consultant old age psychiatrist at Te Whatu Ora Waikato. His research interests are in the fields of Pacific mental health, old age psychiatry, and dementia prevention. Welcome.
Kia ora koutou. So I'm Etu, as Bridget said. And the good news is I can keep this short because Pauline's actually covered most of what I wanted to cover. She has beautifully covered the entire background of the reasons why interRAI assessments at the point of assessment may not necessarily be representative of the community that they're serving. And one of the impetuses for this study, which I've got a few in the room here that are part of it. I've got Gary, Xavier, Devita at the back there, who's our project manager. We're very lucky to get a HRC project grant to look at this exact question. So just really briefly, as Pauline, covered really well, one of the issues with the interRAI is that we can only ever analyze the data of people that have had an interRAI. So basically, we can only look at people who have been assessed. And if we look upstream at the barriers that we face to getting an assessment, the access barriers, if we look at, as Pauline talked about, the kind of issues around the assessment itself and how culturally appropriate it is, how complex it is, the kinds of questions that are asked, whether people are willing to divulge information. There's a lot of issues upstream of the assessment that potentially are either meaning that we're missing people who should be getting assessment but aren't, or that the data that we're collecting from them isn't necessarily as accurate as potentially it could be. And I've been really fascinated by the presentation that I'm following, because the other end's just as important. Just because you have an assessment doesn't necessarily mean that you utilize the supports and services that you are eligible for, that potentially the NASC service has said you can take up if you feel you need it. And we know that in Pacific communities in particular, there are issues all along that pathway of actually getting an assessment, of the nature of the assessment, and then out the other end of, even if they've had an assessment, whether what's offered to them is seen as appropriate, whether they're going to use what's offered to them, and then finally, even if they use it, whether it's actually effective and whether they're getting the health outcomes and the benefits that we expect them to based on the wider population. So the aims and objectives of our project are really these. It's one, to try and quantify the level of unmet need in the community. Two, to look at people who've had an assessment and see whether we're picking everyone up that should be, whether people that have had an assessment are being offered the supports that they're eligible for, whether they're taking up the supports that they're eligible for, and then finally, looking longitudinally down the line and saying, actually, if you've had an assessment, is this actually impacting on health outcomes? In the case of our project, 12 months down the line, but potentially we can look at longer as well. So this project is really 4 separate studies that are kind of interlinked. The first one is to ask who is actually receiving an interRAI. So we've linked in with 3 large Pacific providers, the Whono up in Auckland, Kautu Pasifika in Waikato, and Etu Pasifika in Christchurch. And this first study is really just to look at, in a primary care community of people over the age of 60, who has actually had an interRAI assessment and who hasn't, just as a kind of broad brushstroke. And that way we'll see what proportion of Pacific people over 60 are actually getting an assessment in the first place, regardless of need. I don't quite know what's happened with the formatting. But from that first study, the second question, this is kind of the crux of the study, is who are we missing? So what we want to do is we've got funding to basically go into those 3 providers from the last slide and recruit 400 Pacific people over the age of 60 who have never had an interRAI and basically give them an interRAI. And it's going to be a 2-step process. So we're going to give all 400 of them an interRAI contact assessment. And if they meet the threshold to progress on to a home care assessment, we'll progress on to that. And I think that is going to tell us what the unmet need is in the community, or that's what we're aiming for. The third question that we want to answer is, why are they missing? And we know that throughout that entire journey, from whether you're referred to get an assessment, whether you have an assessment and are offered services, whether you utilize those services or not, there's going to be attrition at every step of the way. I mean, that's going to happen anyway. So this qualitative work is going to be led by Associate Professor Sione Waka, who's a researcher out of the University of Waikato. And what we want to do is we want to talk to a cohort of, say, 20 to 25 elderly Pacific people and their carers and their support people to effectively explore those questions at the bottom there. You know, what are their thoughts about the assessment? What were their thoughts about the assessment if they had it, if they haven't had it, of what they've been offered, of what they're using, whether they think it's fit for service, and other questions like that. And I think that's going to give us kind of the really useful qualitative information about, you know, Pacific views of the assessment process, the services available, and whether they think they're fit for purpose or not. And then finally, we're going to look at outcomes. So basically take those 400 people and then longitudinally follow them up over time in many of these routine data sets. It's really exciting that home-based supports are now going to be linked in, because previous work that we've done with people like Sarah Cullum has actually been going to the DHB itself and getting the invoicing data. But if this data is much more easily available, then we can actually look at the hours of care that people are receiving. And also linking into hospitalizations, emergency department visits, mortality, and so on, to actually look at what the outcomes are, the health outcomes are, 12, 18 months down the line from having an assessment, from getting the care they need. And hopefully what we'll be able to find out is, one, what the level of unmet need is in the community, who are eligible for services but aren't getting an assessment. We can find out the reasons why they're not getting an assessment. And then we can look at, if they have an assessment, what the outcomes are down the line. Thank you.
Now, that's a really interesting topic that we want to hear about next year, right? When will you be able to report back?
Maybe next year, maybe the year after.
Yes. We'll keep a seat for him. Questions? Oh, Hamish, you haven't. I'm just choosing him. He put his hand up first now.
Thanks, Edu. It's a really interesting study and very important. I just wondered, do you think assessor ethnicity may have something to do with uptake and the number of Pacific ethnicity assessors? And are you going to measure that and assess that in terms of who's doing the interRAI and things like that?
So does ethnicity of the assessor matter? I don't know. I think it does make a difference. I know in the Pacific population, we have very few Pacific assessors. One of our aims is to get Devita at the back there, who coincidentally is wearing the same shirt as me, and it was not planned. But clearly we went to the same sale. Is to get Devita as a nurse trained up to do the interRAIs, and I think that will go some way. Yeah, I don't know. I think it does make a difference.
Thank you. Nari?
I've got a similar question, but it's about research integration into service models. So when you do your interRAIs from the research perspective, how will you make sure that the findings are integrated into service provision? Because often I have found there's a huge mismatch there. You do your thing, you tell people what to do, but they don't do it. So that's a question.
So our aim is to send the interRAI assessments to the relevant NASC agencies anyway. I haven't actually talked to them yet.
You have to talk to them.
I know.
They have to get them, and then they have to.
I know.
Yeah.
I know.
Yeah.
But yeah, the aim is to, because they're validated assessment, is to send them on anyway. But then it's up to NASC to decide on all the other aspects of what they're eligible for based on the assessment. So we have no say on that.
Yes, Etu, thank you very much. A few years ago, interRAI, Deloitte's did a culturally appropriate assessment model for assessing Māori. Do you think there might be some findings from your research that would lead to what Hamish suggested, that there might be a model that would support assessors assessing Pacifica?
Yeah, I mean, I'll be honest, I'm not too big on models, but I think there's going to be a lot of overlap with what the Māori community has kind of talked about. I think there might be some subtle differences. Hopefully the qualitative work will pull that out a bit more.
Right, thank you. And another question here.
Oh, kia ora, Etu. That was really interesting. I'm Mary Silcott from the Ministry of Health. I just wondered about the age. Would you consider looking at disabled Pacific as well? Because I know from my background as an OT, people don't take up the services because of cultural, and they're not suitable, and people miss out on a lot when they're disabled. So I wondered if that was something you'd thought about.
So we're not going to look specifically, we're not going to actively look at disabled. What we want to do is just get interRAIs on anyone over the age of 60 who's Pacific, to try and get a much more representative cohort of the base population. I would hope that many people with disabilities had already been picked up. We've deliberately gone down to 60 rather than 65 because of the issues around comorbidities and younger onset of disease. So potentially that 60 to 65 age group will pick up slightly more than we'd expect.
It looks like we've got someone from online.
Hi, this is from Steve Green. Will you be looking at who completes the interRAI assessments? For example, home and community providers deliver interRAI contact assessments in some districts and regions rather than the NASCs completing them for all other districts and regions?
Yeah, thank you. So our aim is to do all of the interRAIs ourselves because they aren't coming through the standard referral pathway.
All right. Well, thank you very much for that. Thank you.